Lansoprazole reduces the amount of acid your stomach makes. It's used for indigestion, heartburn, acid reflux, and gastroesophageal-reflux-disease. Lansoprazole is also taken to prevent and treat stomach ulcers. Sometimes lansoprazole is taken for a rare condition caused by a tumor in the pancreas or gut called Zollinger-Ellison syndrome. Lansoprazole is only available on prescription. It comes as capsules and tablets. How and when to take lansoprazole? You'll usually take lansoprazole once a day, first thing in the morning. If you take lansoprazole twice a day, take one dose in the morning and one dose in the evening. Lansoprazole works best if you take it at least 30 minutes before a meal or snack. That's because food stops some lansoprazole getting into your system. Dosage and strength. The usual dose to treat indigestion is 15 mg to 30 mg a day. Acid reflux is 15 mg to 30 mg a day. Stomach ulcers is 15 mg to 30 mg a day. Zollinger-Ellison syndrome is 60 mg a day. This can increase to 120 mg a day depending on how well it works for you. Doses are usually allowed for children, other people, and people with liver problems. Each tablet or capsule contains 15 mg or 30 mg of lansoprazole. Contraindications. Lansoprazole is not suitable for some people. To make sure it's safe for you, tell a doctor before taking lansoprazole. If you have ever had an allergic reaction to lansoprazole or any other medicines, have liver problems, are pregnant, trying to pregnant, or breastfeeding, are due to have an endoscopy. If you're going to have an endoscopy, ask your doctor if you should stop taking lansoprazole a few weeks before a procedure. This is because lansoprazole may hide some of the problems that would usually be spotted during an endoscopy. Precautions. Lansoprazole is not usually recommended if you are pregnant. You may wish to treat your symptoms without taking medicine. You can try eating smaller meals more often and avoiding fatty and spicy foods. Sit up straight when you eat, as this will take the pressure off your stomach. If you get symptoms at night, you could prop your head and shoulders up when you go to bed. This helps to stop stomach acid coming up while you sleep. Side effects of lansoprazole. Most people who take lansoprazole do not have any side effects. If you do have any, they are usually mild and go away when you stop taking it. Talk to your GP or pharmacist if side effects get worse or do not go away after a few days. Common side effects may include headaches, diarrhea, stomach pain, constipation, wind, feeling sick or vomiting, itchy skin rashes, feeling dizzy or tired, sore mouth or throat, feet or ankle swelling, depression.